the galaxy of intellectuals, honorable guests, benevolent teachers, and beloved delegates. A very good afternoon to all of you. It is my great pleasure to welcome you all to the inauguration ceremony of the 10th Aiogn India Conference 2021. The theme of the conference is Elimination of Cervical Cancer from Research to Practice. I take this opportunity to invite our chief guest, Dr. V.K. Paul, member Niti Aayog, guests of honor, Shri Rajiv Gauba, Cabinet Secretary of India, and Dr. Sunil Kumar, Director General of Health Services, Government of India. I do invite Dr. Randeep Guleria, Director AIMS, New Delhi, Dr. Sabita Gupta, President of Aiogn India, Dr. Lata Balasubramani, Secretary, Aiogn India, Dr. Neerja Batla, Organizing Chairperson of the conference, and Dr. Seema Singhal, the Organizing Secretary. No program is complete without seeking blessings from the Almighty, and we shall commence the inauguration with lamp lighting and Saraswati Vandana. I request all the dignitaries for lamp lighting.
Ya kundedu tushare hare dhamala, ya shubhe vastavrita, ya veena varidand mandit kara, ya shwet padmasana.
Thank you, esteemed dignitaries. I take this privilege to invite Dr. Neerja Batla ma'am, the organizing chairperson of this conference and the head of the Department of Obstetrics and Gynecology, AIMS New Delhi, for a welcome address. Over to you, ma'am.
So, we have already introduced you. Good afternoon, ladies and gentlemen. You know, there is a power outage here, so you're probably seeing this very dim. I'm connecting from my phone. To the Honorable Member Niti Aayog, Professor V.K. Paul, Shri Rajiv Gauba ji, Cabinet Secretary of India, and Dr. Sunil Kumar, Director General of Health Services, Government of India, Professor Randeep Guleria, Director AIMS New Delhi, Dr. Sabita Gupta, President Aiogn India, Dr. Lata Balasubramani, Honorary Secretary Aiogn India, dignitaries in the audience, ladies and gentlemen. It is with great pleasure that I welcome you all to the 10th National Conference of Asia Oceania Research Organization on Genital Infections and Neoplasia, India 2021, with its theme, Elimination of Cervical Cancer from Research to Practice. This national meeting brings together global scientists and clinicians whose areas of interest is genital infections and cancer. This conference is a landmark in our collective journey for overcoming this dreadful and yet preventable disease, as it is the first conference after the launch of WHO's Global Strategy for Cervical Cancer Elimination in November 2020. Although there has naturally been a setback to preventive services during the COVID pandemic, there is optimism that with strong political will, cervical cancer too will cease to be a public health problem, with initiatives similar to the ones that were launched for reducing maternal mortality or controlling the HIV/AIDS epidemic. Services that are rolled out for screening of one type of cancer will have a positive synergistic effect on screening of breast and oral cancer too. Linkages developed for management of screen-positive cases will improve referral for other cases as well. And digital solutions for data management and follow-up will be useful across the board for all non-communicable diseases. Augmentation of treatment facilities will similarly have an impact not just on cervical cancer, but also on other cancers as capacity building for surgical skills augments facilities and provision of more radiotherapy units improves capability for treating other cancers as well. Palliative care is gaining the importance it deserves to allow women with advanced cancer to live with comfort and dignity. We can indeed look forward to taking steps to a cervical cancer-free future. And I am proud to say that this conference addresses all these aspects and all the developments. As we reach the end of this year, we can rejoice in the expectation of having an indigenous HPV vaccine rolled out in 2022. There is convincing data from the Nordic registries and from UK about the impact of the HPV vaccines in preventing cervical cancers. The magnitude of this impact has been greater and has come earlier than was envisaged based on epidemiological predictions. The availability of an affordable vaccine is not only good news for India, but for many LMICs. 85% of the burden of cervical cancer we know is in the LMICs. In this conference, all stakeholders have come together: gynecologists, pathologists, virologists, community medical officers, advocacy experts, modeling experts. Nurses and ASHA workers have attended the community screening workshop yesterday, including nominees from CRPF, NHM, and central government institutes. We had a total of 4 very interesting workshops attended by more than 250 participants. Tomorrow, there will be a public forum as well to engage with the lay public. Although this is a national conference, we have participants from 15 countries. This has been a spin-off gain from the COVID pandemic, which has allowed us to connect virtually, to cooperate, to share information and knowledge, and build on it. Our organizing team of Aiogn India 2021 has worked very hard, supported by the executive committee members, to prepare this academic feast for you. All the international and national faculty members are stalwarts in their field. Participation of faculty from WHO, IARC, NCI, JPIGO, CFI, ACS will undoubtedly enrich our knowledge and help us to refine our strategies going forward, incorporating new tools and algorithms and incorporating cost-effective strategies with quality assurance. I hope you enjoy the next 2 days of this academic feast, and thank you for being here and for your participation. Thank you.
Thank you, ma'am, for your enlightening words. It's indeed a great pleasure now to invite Dr. Randeep Guleria, sir, Director, AIMS New Delhi, to address this August gathering.
It's my pleasure to be here at the 10th National Conference of Aiogn India 2021. The theme of this conference is very, very important, and that is elimination of cervical cancer from research to practice. The diagnosis of many cancers has been delayed, and an early curable stage it has reached a more advanced stage where only palliative treatment is available. And this has led to a huge crisis for those families that have patients suffering from cancer. Because cancer not only affects the patient, but takes down the whole family. And it has severe financial implications. Cervical cancer, as we all know, is the second most common cancer next to breast cancer in India. But the years of life lost to this cancer is more than what we see in regards to breast cancer or ovarian cancer for that matter. Also, many of the women who have cervical cancer are in the prime of their lives, they have young children, and therefore the impact it has on society, on families is much more than what one would see in cancers which occur at an older age group. And what is even more sort of sad is the fact that this is a cancer which is preventable and if diagnosed early is curable. Therefore, there is an urgent need for us to see what we can do as far as early diagnosis and prevention of cervical cancer. I am therefore pleased to learn that Aiogn India conference, which is being organized by the Department of Obstetrics and Gynecology at the All India Institute of Medical Sciences, New Delhi, has brought together a number of international and national experts from the field, and they will share their experience and see how they can help young doctors to enhance their knowledge as far as this area is concerned. So there will be scientific deliberations on the HPV vaccine, screening, treatment and palliative services, and this will help not only people to gain knowledge, but it will also promote awareness and improve practices. And this, I'm sure, will help us to really eliminate cervical cancer in the future. Last year, on the 17th of November, WHO launched the global strategy to eliminate cervical cancer, and the aim there was to vaccinate 90% of girls by 15 years of age, screen 70% of women with an effective test twice in their lifetime, and treat 90% of precancerous and cancerous lesions. This is a very ambitious target, but I hope that this can be achieved by 2030, and this will enable countries to move towards the road of elimination. This will also be the first of its kind endeavor to eliminate cancer. I think this is something that we all need to work on at a war footing. I'm very happy to really see that AIMS conducted a national webinar that brought together all stakeholders to assess the current available resources and determine the way forward. Each area will have to look at what are their own resources, their own social structure, and determine the way forward when we talk of eliminating cervical cancer. Also, we need to see how we can do this with the new normal that is going to happen because of the COVID pandemic. I hope that next year we will see a restoration of a lot of activities, and this could have immense implications for us to come back to our goals of trying to eliminate cervical cancer by all the activities that one is planning to do. On the 17th of November this year, the team at AIMS spearheaded a national-wide pledge taking ceremony in which doctors, nurses and other healthcare workers pledged to work to achieve the elimination goals as well as to engage with policymakers and NGOs to enhance capacity building. This was incorporated into the WHO report of activities around the globe to mark the anniversary day. I'm pleased to learn that this simple activity enhanced awareness considerably and even encouraged our own employees to come forward to accept preventive services including HPV vaccination and screening. I think this has gone a long way, and I'm sure that this will help to increase awareness in the medical profession. I'm also happy to learn that the WHO Collaborating Center at AIMS has initiated a multi-center project to improve screening coverage of eligible women to ensure that 70% of women who visit not only the obstetrics and gynae OPD, but all OPDs at the All Institute of Medical Sciences, New Delhi, will be offered screening services, and one will try and understand the barriers that they are facing. This will also go a long way in really implementing the policies that one wants as far as cervical cancer elimination is concerned. This fits very well into the mandate of the All Institute of Medical Sciences, the trinity of mission, that is patient care, teaching and research. And I think all of these are important when we look at cervical cancer elimination. We have to be not only providing good patient care, but looking at teaching and also research. And that is one of the mandates that the National Cancer Institute at Jhajjar, Haryana has, which was inaugurated in 2019 and is the largest government-run cancer facility. I'm sure with the translational research that is going to be done at this center, we will also be able to have data which will help us to understand how we can move forward in the elimination of cervical cancer. I wish all the faculty and the delegates of Aiogn India 2021 all success, and I'm sure this conference will really be the highlight as far as cervical cancer elimination program is concerned. All the best. Thank you very much.
Thank you, sir, for these motivational words. I would now request Dr. Lata Balasubramani, the Honorary Secretary of Aiogn India, to present the Secretary's report. Over to you, ma'am.
So it is my great pleasure to present the Secretary's report of our esteemed organization. So Aiogn India promotes education, sharing of information, community-based health initiatives and research that will ultimately prevent deaths due to cervical and other genital tract cancers. Our members are from various specialties: obstetrics and gynecology, pediatrics, pathology, microbiology, preventive medicine, and family medicine. The vision of our organization is to reduce the burden of diseases caused by reproductive tract infections, especially HPV. And our mission is to work with governmental organizations, NGOs, learned societies, healthcare workers, and lay public, working towards prevention, early detection, and management of cervical and other genital cancers. In lieu of the national conference, which we were unable to do last year, we had an academic session. And this, as the organization promotes research, this was geared towards research methodology to ensure that our youngsters learn the basics of research. And there was also a focus on clinical practice lecture series. There were 7 lectures, 2 case-based discussions, and 2 paramedical webinars, which was attended by more than 500 delegates from ASHA workers, so that this information regarding cervical cancer goes not just to the medical fraternity, but goes down to the paramedical workers as well. COVID kept us in, but it did not keep us down. So we ended up this academic sessions with fun and frolic, which I think was a good relief for all our members as well. November 17, 2020 was D-Day, when the WHO called for elimination of cervical cancer. Our members helped by putting up awareness talks. We had buildings lighted up in teal and to promote awareness within their respective communities. Our newsletter brings to our members what is the latest in research that is going across all over the world. It brings us snippets of clinical information on how best to treat our patients as well. We have a very active, interactive website that has teaching resources, which is of great help to our members. And November 17, 2021, we had a spontaneous response to our call to create awareness. And we had well-known buildings all across the country lighted up to ensure that there was awareness in the community and the country. The WHO had requested all its states to take a pledge towards working towards elimination of cervical cancer. And this was done with great enthusiasm amongst all our members. One of the more recent is our collaboration with the International Papilloma Virus Society. And for the next year, 2022, they have come up with a slogan of one less worry. So amidst so many worries, we have to take it, let us have one less worry by working towards either vaccination for our adolescents or screening for our women. So we also fund community screening activities, we fund travel grants, and we are currently working on creating a public movement for advocacy involving governmental organizations, medical organizations, teachers, Rotary, Lions, Roundtable, pharma, NGOs, and educational institutions. We've had a wonderful start to our conference. We've had workshops yesterday. We've had deliberations of the highest scientific caliber in the ongoing annual conference, and I'm sure this will help in policy decisions and will also be incorporated in our clinical practice. Thank you very much.
Thank you, Dr. Lata Madam, for letting us know about the progress of Aiogn India. I would now invite our guest of honor, Dr. Sunil Kumar, Director General of Health Services, Government of India, to enlighten us with his words of wisdom.
Friends, I am delighted to address the assembly here for the 10th National Conference of Aiogn India. The theme of this year's Congress is eliminating cervical cancer from research to practice. It is gratifying to know that Aiogn India has been striving towards elimination of cervical cancer from India. As you know, cervical cancer is the second most common cancer affecting Indian women. The incidence and mortality of this disease is a reflection of the available resources and the medical infrastructure for population-wide screening and treatment. Implementation of cervical cancer prevention programs, that is, the screening linked with treatment of precancers and HPV vaccination, can lead to significant reduction in incidence and mortality to a level where it will no longer be a public health problem. A research project by IARC in Tamil Nadu and TMC Mumbai have shown that even 1 to 2 rounds of screening by simple methods of VIA could lead to reduction in the incidence and mortality due to cervical cancer. This led to the development of state-wide program in Tamil Nadu. In 2016, the Honorable PM announced a call for nationwide screening for 3 cancers: breast, oral and cervical. And within 3 months, the Ministry of Health and Family Welfare prepared the operational guidelines. The NPCDCS, that means the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke guidelines, have adopted VIA as the test of choice, with 5 yearly screening among women aged 30 to 65. The program has been rolled out already in more than 300 districts. Although we need to do a lot more effort for training, setting up linkage for treatment and follow-up, and also in record keeping, etc. The launch of global strategies for elimination of cervical cancer as a public health problem by WHO was a landmark event last year, and India is signatory to this declaration. WHO recommends screening at 2 time points in women's life with an effective test like HPV test at the age of 35 years and again by age of 45 years. While we see the merits of this approach, presently there are logistic challenges in India: the cost of tests, setting up of laboratories, transporting samples, communicating reports, etc. A Make in India effort is urgently required to make HPV testing affordable, point of care and widely available for not only in India but also for all LMICs. But HPV testing will still require triage either by VIA or by colposcopy. Newer technologies like battery operated affordable portable devices for screening will help us reach primary facilities. There are already some indigenous efforts in this direction, and we welcome more of such developments. Reaching the rural areas where the incidence is very high or can be said to be the highest, and where the majority of the women are socio-economically disadvantaged with no formal education and no awareness of the risk factors associated with the development of the disease. This is our top priority. Implementation of any program is always a challenge. The healthcare workers need to be trained and retrained to implement these screening programs at the grassroots level. There is a dire need to raise awareness about the preventive strategies amongst the general population. So I am glad that the healthcare professionals from the last mile facilities like nurses, ANMs and ASHA workers are being involved in the community screening workshop. Ministry of Health and Family Welfare also emphasizes upon a multidisciplinary approach to cancer treatment and its availability at all regional cancer centers. Under the Pradhan Mantri Jan Aarogya Yojana, treatment for cancer is made accessible to economically weaker sections and underprivileged women. The establishment of a national cervical cancer screening register is also an emerging need of the nation. Provisions of an electronic infrastructure for collection, storage, analysis, and reporting of the screening program data and the linkage of the screening registries with the cancer registries are the goals for our future. It will help to generate comprehensive data to inform policy and improve program quality and service delivery. Healthcare providers may get better access to quality health information with the help of these registry. The conference program brings together stalwarts from all over the world working in the field of gynecological cancers and preventive oncology to share their knowledge and experiences to transform research into practice. I am looking forward to implementable solutions to make cervical cancer a story of the past, and I am sure of your support for this noble cause, as is from our side too. Thank you very much. Jai Hind, Jai Bharat. Friends, I am delighted to
Thank you, sir, for the promising words. I now request our guest of honor, Sri Rajiv Gauba sir, Cabinet Secretary of India, to address this August gathering.
Chairperson Dr. Nirja Bhatla and distinguished participants. It's a privilege to be here at the inauguration of the 10th National Conference of AOGI in India. It is gratifying to know that AOGI in India has been working assiduously for elimination of cervical cancer from India. As we all know, it was last year on November 17th that the World Health Organization launched Global Strategy for Cervical Cancer Elimination. It is signed by 194 countries. India, of course, is one of the signatories. Modern society has benefited enormously from advances in medicine in terms of better healthcare, increased longevity, etc. But with longer years, lifestyle changes, and the stress of modern life, new challenges have also appeared. Rising incidence of cancer is one of them. Cancer concerns us all. It is estimated that out of every 9 individuals, one person will develop cancer during her lifetime. It is one of the top 10 causes of death among Indians. Now, these are figures that should ring alarm bells. It is high time that we consider war on cancer a national priority. Besides physical and emotional suffering, there are serious financial implications, particularly for those not so well off. Cervical cancer is the second most common cancer affecting women. And unfortunately, large majority of these cases get diagnosed in an advanced stage in the middle age group, leading to loss of valuable life years. This is especially poignant considering how preventable this disease is. In 2018, WHO first declared that every country can eliminate cervical cancer as a public health problem. Since 2016, even before this call by WHO, and in fact in response to our Prime Minister's exhortation, India has started working on nationwide screening of 3 common cancers, cervical cancer being one of them. This is already operational in over 300 districts, and our endeavor is to expand it to all districts in the country. Our medical professionals have accelerated their efforts towards achieving the goal of a cervical cancer-free India. We now have to find ways to move to HPV test, which is far more accurate, requires fewer testings in a lifetime, and is more likely to ensure reduction in cervical cancer incidence. There are already efforts to work towards a Make in India test for this purpose. I'm happy to know that all stakeholders will be coming together to discuss efforts to promote affordable and widespread HPV testing. We have seen during COVID-19 how, as a nation, our scientific community, medical fraternity, and industry rose to the challenge, and we were able to develop indigenous capacities in a very short time for testing kits, for ventilators, for vaccines, and so on. The same spirit is now required to address this challenge. It's also now time to look into preventing this cancer with effective and safe HPV vaccines. Data is now available from Nordic countries and lately from the United Kingdom, providing early evidence of the impact of these vaccines on cancer reduction. Our own Indian vaccine has completed phase 3 trials, and we now look forward to its launch next year. It's equally important that we create community awareness about this cancer and its preventive aspects, about the importance of screening and the adverse impact for the women and their family members if it remains undetected or is detected late. Secondly, we need to improve the access to care. There are no doubt gaps in infrastructure, issues of inadequate workforce, and absence of linkages between the primary, secondary, and tertiary levels, and also lack of patient coordinators to ensure easy access to preventive, promotive, and curative services. Not only do healthcare workers need to be trained and retrained to implement these screening programs at the grassroots level, but we also need public-private partnerships to bring together all sections of society and also get CSR efforts into this to facilitate various measures to address this complex problem. AOIGN India Conference is a welcome step towards acceleration of cervical cancer elimination. It is bringing together pioneers, experts, specialists from all over the world working in the field of gynecological cancers. They will share their knowledge and experiences and hopefully help transform research and knowledge into practice. I am confident that this conference will provide implementable solutions to make cervical cancer a story of the past. I can assure you that the Government of India will not spare any effort and will do everything possible to support this noble cause. Thank you.
Thank you, sir, for the encouraging address. Now, I request Dr. Sabita Gupta ma'am, President, Aiogn India, to present the prestigious Lifetime Achievement Award to Dr. R. Sankar Narayanan and to throw light on his life and achievements. Over to you, ma'am.
Thank you. It is an honor and privilege to felicitate Dr. Rangaswamy Sankar Narayanan with the prestigious Lifetime Achievement Award for his outstanding contribution in the field of oncology. He did his MD, Radiotherapy and Clinical Oncology from the University of Kerala, India, followed by postdoctoral training in San Francisco, Pittsburgh, and Cambridge. He has worked in collaboration with several colleagues, several national and international organizations, which include Regional Cancer Center, Trivandrum in India, the International Agency for Research on Cancer of the World Health Organization, Lyon, France in 1993. With par excellence in his field, he has been the special advisor on cancer control, head of the Cancer Early Detection and Prevention Section, IARC, and head of the screening group until his formal retirement in December 2017. His glorious journey doesn't stop here. Presently, he is a senior visiting scientist, International Agency for Research on Cancer, that's the WHO, IA, Lyon, France. He is Director, Preventive Oncology, Karkinos Healthcare India. He has a strong commitment to research, training, program development, cancer healthcare delivery, and technical assistance in the early detection and control of cancer, particularly the breast cancer, cervical, colorectal, and oral cancers in LMICs. His expertise includes studies assessing cancer burden and planning, implementation and evaluation of cancer screening, and control programs and cancer information systems. He has published more than 200 manuscripts in international peer-reviewed journals and widely traveled in more than 100 countries to make his tireless efforts in the field of cancer prevention. His efforts have been recognized worldwide, and he has been conferred with numerous prestigious awards like the Rio Grande State Legislature Medals for Services towards Women's Cancer Prevention, 2017. American Association of Physicians of Indian Origin, International Award for Excellence in Clinical and Global Oncology in 2016, British Society for Colposcopy and Cervical Pathology Founders Medal, UK in 2017, and Ernst Wertheim Prize, Vienna, Austria, 2015, and he has many more to his credit. I'll request Dr. Rangaswamy Shankar Narayanan to kindly accept this award. Sir.
Thank you, ma'am. I now request Dr. Shankar Narayanan, sir, to say a few words.
Thank you, madam. Thank you, Dr. Gupta, for your kind words. And at the outset, I would like to thank the organizers of the Aiogn office bearers, particularly my colleagues, Dr. Nirja Bhatla, Dr. Shalini Rajaram, Dr. Seema Singhal, and so many colleagues in the organization for this honor. I do not know I deserve it, but I thank you very much for this recognition. I consider this recognition as a recognition of all the co-workers who have worked with me in several countries over the last several years, and to my late parents and to my family. And it has been such a pleasure to work with various colleagues in India as well as several countries across the world. And this is a collective work what we have achieved. And I consider myself only as a glorified server rather than somebody who had worked and toiled on a alone. So that way, I consider this as a great honor and a great recognition for my colleagues and my family. Thank you very much, and I really appreciate your kind words and your kind recognition. Thank you, ma'am.
Thank you, sir, for enlightening us. The Congress has received an overwhelming response from students, scientists, and other delegates in the form of scientific abstracts. The abstracts and other scientific updates of the conference have been compiled in the conference souvenir. I request the Chief Guest, Dr. V.K. Paul, sir, along with other dignitaries, to release the conference souvenir. Thank you, esteemed dignitaries. I'm extremely privileged to welcome our chief guest, Dr. V.K. Paul, sir, an eminent neonatologist and a globally recognized medical scientist. He is a member of Niti Aayog, and he has played a pivotal role in formulation of key initiatives of the Government of India. Now, I request Dr. V.K. Paul, sir, to say a few words to encourage us. Over to sir.
Thank you. Am I audible?
Yes, sir.
Thank you very much. Good afternoon. I'm pleased to be here in the company of Shri Rajiv Babaji, Cabinet Secretary, Dr. Sunil Kumar, DGHS, Dr. Randeep Guleria, my distinguished colleague at AIMS, whose messages you heard. Pleased to be here, be hosted by Dr. Sabhyata Gupta ji, President AOIGIN, Nirja Bhatla, my friend and colleague for many, many years, organizing chairperson. I'm pleased to be also be in the company of legendary Dr. Shankar Narayanan ji, Seema Singhal ji, Lata Balasubramanian ji, and distinguished leadership of obstetrics and gynecology, whose several names I noticed on the screen. It's a real honor because we have the apex fraternity of obstetrics and gynecology with special interest in addressing the problems of cervical cancer and genital infections. I also extend my welcome and thanks to colleagues from countries other than India in this Asia-Oceania research organization that you represent. First and foremost, I really appreciate the composition and the focus of AOIGIN. Why I say this? Because you have picked up a mission which is finite, which is doable, and for that, very uniquely, you have brought together different experts and stakeholders. That's remarkable because when you have only a single specialty or a single expertise organization, it has many advantages, and there must be many of these. There should be many of these. They play a very, very important role, no doubt. I'm part of a few of them, and as you all would be. But then to deliver on scale often, and particularly taking the public health approach in particular, only expertise of one shade of gray is not going to work, or pink for that matter. It's not going to work. And therefore, I think it's a remarkable smartness that you have shown in creating a forum which has clinicians of different specialties, obstetrics, of course, and pediatrics, pathology. And then you reach out to community medicine, you have other stakeholders, and even an extension to grassroots workers. So I think this is an amazing DNA of your GIN, which bodes very well for the purpose that you have enshrined. There's no doubt that it has the potential to crack these problems that are on your mission. So thank you for establishing such an organization. And if it is the 10th meeting, obviously you are thriving very well. Congratulations. And I compliment the leadership of Aiogn and compliment the work that you have done through your members. A lot has already been communicated to you through the messages that you received from very eminent guests of honor that have already transpired. I would simply go to more practical aspects because the way your mission is focused, you must continue to advance a focused approach step by step. And clearly, for quite some time now, the idea to eliminate cervical cancer has already come for this nation. There is absolutely no doubt about it. So I endorse that motion. And in my extended work beyond child health, been engaged with MDG 5 related work and then, of course, SDG related work. And I do fully agree that this disease has no business to be there anymore. We have the solutions, we have the understanding. It's a very, very achievable mission to control this disease, to eliminate this disease from the face of this planet. I particularly endorse this mission from the heart because this disease affects the poorest women and mothers. The poorest. Not that other cancers, which may affect more affluent society, are unimportant, no way. And of course, no cancer spares no social strata in that sense in any case. But when you look at the epidemiology of cancer cervix, the poor suffer the most. And to have 78,000 deaths each year in our nation because of this cancer, which is preventable and treatable in a combination of interventions, is therefore an equity issue as well. And therefore, it inches up as a higher priority on that principle as well, amongst the facts that we have the solutions and they're waiting to be scaled up. You already heard that the nation has a program to screen for this disease. You already heard that there is a vaccine. We may be close to a vaccine. Let me try to see what practical things we can do. And that's my message to you. You already have a fair amount of idea how things are from the previous messages. I like to know how far we are from the indigenous HPV vaccine, what the results look like. I invite you to discuss this with me, and then we start preparing an advanced plan to see how the scale up has to happen. Will it be phased? Will it be, can it be free? Is it affordable? What are the challenges of vaccinating girls of a certain age across the nation? In the context of COVID-19 vaccination, we very quickly learned how adult vaccination is to be taken to scale, and that's now a legendary experience that the world has looked upon, and India has created that model of sorts. So nothing is impossible, but then how do we do it? What are your thoughts? What is the cost implication? And so on. So I'd like to understand this a little more. Likewise, you've said that, so that is the first piece. And will we have enough capacities? Can we get more people to do the same vaccine? Do we need more vaccines? So I like to get to that kind of a detail in a conversation with your leadership. Similarly, I like to know the second piece. What is holding us back for this Make in India diagnostic? Who's making these efforts? Which companies are engaged? Are they making sufficient progress? Can we expedite the progress? I've been privy to the journey of vaccination for COVID on a daily basis. We have a paradigm to work with where such solutions can be accelerated. We can do the same for these diagnostics and this particular vaccine as well. How convenient would the possible new diagnostics can be? How long will it take? What is the cost? How to scale it up? Again, I like to take stock of this and see where the nudge needs to be given. Is it the research laboratories or is it the companies, and how do we engage them? So I'm looking for to understand the practical issues, specifically the bottlenecks, especially to understand where a nudge from a government arm such as Niti Aayog and the Cabinet Secretariat, as my distinguished colleague Rajiv Babaji indicated, can make a difference. and we are there to do that. On the issue of treatment comes first the issue of screening and detection. I like to know from you, what is the learning, or from the ministry jointly, what is the learning from the screening at 300 districts? Are you as academics satisfied with the approach being taken? Sure, it is helping, but is it good enough in terms of sensitivity, specificity, detection, etc., on a very solid scientific grounds? Because if we miss somebody or we delay the detection, we haven't really met the objective, but not met the purpose. So is this working? And of course, if it is detecting, what happens to the woman thereafter? In how many women are we able to complete the full cycle? Detection by protocol, referral, and treatment as appropriate. And then back to home, if required, follow-ups, and if required, palliation. How often are we completed this cycle? I'm aware of a ICMR study a few years ago where this was attempted in a systematic manner, and I know that we had a model of sort to begin with. We didn't have a perfect model. So now that the first point is being taken care of in terms of screening, officially at least, how good we are. Do we have, is the training that we gave working? So we're looking at points where further work and maybe different work, maybe an innovative work, maybe use of technology, maybe other solutions, maybe community mobilization issues need to be addressed, because this perhaps in some ways is the most labor intensive part. And then to make sure that the woman is on the path, on clinical treatment pathway, and connected to that in a solid way. You have heard that the Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat PMJ, covers the treatment of cervical cancer. And here I want you to understand what it means. It means that technically, cervical cancer in half of India's population can be treated, can be taken care of free by entitlement. Now that's the intent and the promise of PMJ. It's taken care of. Are we connecting enough people to this? Are we connecting after the screening happens? Who is going to work for this? What is your role in this? Is it only awareness that you will do, or is it something more your branches can do? Or is it for the society to do? Is it for the Panchayati Raj people to do, mayors to do, politicians to do? I don't know. How do we search? There is a solution waiting for problems to reach. Obviously, enough women are not reaching. And PMJ, as I repeat, is practical with top-ups from the state government schemes and their budgets, is actually half of India is covered. And I know the utilization is not enough for many packages. Some people are simply not yet connected. We are making efforts. But the efforts of the government alone are not sufficient. What can we do to get women to get connected to this? And then take treatment free of cost, but for which the eligible population therefore doesn't have to shell out their own money, at least for that purpose. So that's another gap that we need to bridge. The point about educating, using telemedicine to educate, point about diagnostic, pathology diagnosis in a time-bound manner, using technology if need be. Whichever way, have we got that system, or do you think that system is not there? If not, a focused organization like you would be the best group to tell us how to do it as a starting point. Again, have some of you reached out to some state governments? Because once you do nationally, what does it mean? You start somewhere. Can we engage using your influence in a few states at district level? We can perfect this entire journey. There's too many pieces. Please appreciate why some diseases have some more difficulty than others. So vaccination for diphtheria is one, jab a couple of times, a few times, and then it is taken care of. It's a system that's already working. But when we are looking at mobilization, detection, pathology diagnosis, then referral, then radiotherapy, then follow-up, then periodic follow-up. But we have to crack it as well. Can you demonstrate to us functional model where everything is working nearly to perfection, so that we can say that this can happen by visualizing and envisioning such a system? We have made a great beginning, but to demonstrate that it works will then be an infectious experience which then others can emulate. It could be even done at state level. For certain states can afford to do so, you know that. Certain union territories can do so. Can we do it on scale? And also, please remember, we are all academics around, most of us. Have we demonstrated this whole cycle? When is the last, big study on this where all the pieces fell in place after ICMR study? Or that gave all the answers? I have no problem. We don't have to do any other study. Why in our own catchment areas of medical colleges and institutions such a system has not yet been established? The point I'm making is that there are some tools that we already have which we can use. There are improved tools that we need, such as a new and simpler diagnostic and more important. We'll work on that. But at the same time, the operational learning as to how this is to be instituted is a journey in which you have a direct role. To get a new diagnostic, we will work with the industry. We will give the nudge if required, if it has not happened already with your efforts. To work for the vaccine availability, great. A lot of role for the government and for all you all. But then to see that the flow of steps happens, algorithm follows, is for the professional public health community to demonstrate. And I give you a converse example now. So we say screening is being done. Is that optimum? If you have learned to do that, then we have taken care of one step. If not, we are still grappling with improving that. So kindly help to set up such sometimes we used to call it pilot or early implementation sites, so to say, and we can work in that direction as well. As I said, given the current responsibility that I shoulder, I'll be very happy to work on a few areas, significant areas of work, and help you with other areas to impress upon others to take forward this very, very important mission. I also would remind you that when we are looking at genital infections with the agenda that we are not really discussing today, again, rapid diagnostic screening methods, use of technology, etc., also has a place for that set of conditions also, which of course are many, many more than the dreadful cancer that we are discussing today. But once again, I'm grateful to Nirja, I'm grateful to President Aiogn and all the distinguished colleagues who invited me to be with you. I would say the time has come not only to eliminate the disease, but before that, the time has come to put all the pieces together. If those pieces are apart, the time for elimination cannot be today. It can only be day after tomorrow. Thank you very much. Jai Hind.
Dr. Paul, I think we have to give you a standing ovation for this speech of yours. We had a lot of champions, but today I feel like cervical cancer has found a godfather. And with your blessings and with your support, we shall finally do it. You have raised all the most relevant points, and we shall certainly be coming to you with our status report, situational analysis, wish list. And just one word, what we are doing with the HPV diagnostics is only what you have guided to work with DBT and BIRAC to develop, and everything else also we shall do with your support. Thank you so much. It is my pleasure on behalf of Aiogn to present you with a memento as a token of our appreciation, and we shall soon be there in person to deliver this. It's not going to come by editorial. It's going to be all of us coming to see you with it. So thank you once again.
Thank you very much indeed. Greetings from Trivandrum, where I am in another meeting. But thank you so much for the opportunity, and don't believe many things that Neerja said. She is my sister, and so therefore we keep telling more than what we believe is deserving. Thank you very much. Have a good day. God bless.
Thank you, sir, for your words of wisdom. Now I would like to request Dr. Seema Singhal, our hardworking and dynamic organizing secretary of Aiogn India 2021, to render vote of thanks.
Good afternoon to the Honorable Chief Guest, sir, guest of honor, all my respected seniors and our esteemed colleagues. On behalf of the organizing team of Aiogn India 2021, it is my privilege to propose the vote of thanks. We are deeply honored by the presence of Professor V.K. Paul, Honorable Member Niti Aayog, as a chief guest to our meeting. In spite of his extremely busy schedule, he has joined us from Kerala and has given us the benefit of his wisdom and experiences. His support, inspiration, and guidance to go forward to integrate Make in India, Digital India, and Startup India will help us go a long way in our efforts for cervical cancer elimination. Thank you, sir. My sincere thanks to respected guest of honor, Shri Rajiv Gaba, sir, who's Cabinet Secretary of Government of India, who despite his inability to join physically because of his busy schedule and ongoing parliamentary session, has nevertheless spared his time to record a message and has shown his support to us. My gratitude to Dr. Sunil Kumar, sir, Director General of Health Services, Government of India, who was also traveling today, but has sent us a recorded message. Sir, we appreciate your leadership in escalating the activities of Ministry for Cervical Cancer Elimination. I take this opportunity to thank our dynamic Foxy President, Madam Shanta Kumari, for always supporting us, and the credit of bringing cervical cancer in forefront goes to Madam. I think I can thank our director, sir, Professor Randeep Guleria, for always being a source of guidance and inspiration and supporting and promoting all our activities. Thank you, sir, for always providing us the administrative, technical, and academic support. Now, I take this opportunity to extend my sincere gratitude to our honorable organizing chairperson, Dr. Neerja Bhatla, to guide us throughout and to bring out the best in everyone working for this conference. Thank you, ma'am, for inspiring us, encouraging us always, and for always being there for us in person and virtually, whenever we needed it, whether it is 12 o'clock, 6 o'clock. During the past few days, she's been guiding us thoroughly. Thank you so much, ma'am. A special thanks to Aiogn India executive members for the opportunity given to us and providing us immense support to organize this immense scientific meeting. Special thanks to our president, Dr. Sabita Gupta, our secretary, Dr. Lata, for providing us support. I'm grateful to Dr. Shalini Rajaram for guiding us plan the scientific sessions, Dr. Rupendra Sekho to guide us the abstracts, reviews, and to plan them, and Dr. Uma Singh to plan the quiz that will be conducted today and tomorrow. We are thankful to all the international and national speakers who participated in this meeting. I express a sincere gratitude to all our senior faculty, senior professors who participated in this meeting and inspired us to do good and better. I would like to extend my sincere gratitude to the conveners of our pre-conference workshops who conducted the workshops in such an informative manner. It is difficult to name everyone, but I would take an opportunity to thank the organizing team members who worked tirelessly throughout this conference. Organizing this conference would not have been possible without the support of the residents of the department and our hardworking gynae MCH fellow onco team. I also extend my sincere thanks to entire staff of the Department of Obs and Gynae, AIIMS, New Delhi. I would also like to thank WHO, IR, JPIGO, CFI, and ACS for being our scientific partners and for extending their support to us. And I thank our pharma sponsors who were there, and we are also thankful to our web platform team who, because of their technical support, we could conduct this event. In the end, I would like to express my gratitude to all esteemed delegates who attended this meeting and their contribution for making this conference a grand success. Thank you, everyone. Have a great day ahead. And with this, we would like to conclude this inauguration session. Thank you so much for being there for us.